Okay, I think I'm going to make a start then, if that's okay. Lots of hands going up. So as Chris just mentioned, if you do have any questions, if you can just pop them in the Q&A, that would be brilliant. We've got a whole team of people who are going to be answering those questions. So please do feel free to do that now if you have a question that you would like to answer us anytime throughout the webinar today. But first of all, thank you all very, very much for taking time to join us on this webinar today. And I know it's really sunny out there, so I appreciate you taking time to listen in, and hopefully you will find it really valuable too. But for today's webinar, we're going to be looking at the updated LTC annual recall system, which we mentioned in our introduction webinars that we did a few weeks back. If I just quickly introduce myself, just in case I've not met you all yet. So my name is Charmaine Jackson, and I head up the training team for Ardens. And as I mentioned, we ran some introduction webinars a few weeks back, and give us a thumbs up if you were able to attend those webinars. Hopefully you were, in which we spoke about the upcoming changes to the system, and we also spoke about why we were changing it, and also when it was coming as well. So this webinar today is very much about walking you through the process now, which is really exciting, in your EMIS systems, that you can go away and you can start using it as well. And thank you for those thumbs up. It's good to see that some of you were on that introduction webinar. Now, this webinar today is only for EMIS practices. So if you are a System 1 practice, unfortunately, you're on the wrong webinar today. Yours is happening tomorrow, and I will get the team to post the registration link in the Q&A so that you can sign up for that one too. It won't be as useful as the one tomorrow will be. So hopefully you are all EMIS practices, and we are good to go. Now, in terms of housekeeping, this is another busy webinar today, so we want to make sure that you are getting the most out of this webinar. So your microphone has been disabled, and it will remain that way all the way throughout the webinar. So if you do have any questions that you would like to answer us, then really do strongly recommend that you use the Q&A section. So if you've not joined one of our webinars before, you may want to spend some time to have a look at where that is. You'll also see an option that says pop out. That's quite useful, because what it would do is it would just show you the screen that I'm sharing rather than me on screen and all of the different initials. You're just focusing on the content. So you may want to find that option as well. And I do have a whole team of colleagues who are ready and waiting to take your questions today. So I want to introduce them quickly. We've got Hazel Quick, who's going to pop on camera quickly. Hazel is one of our training specialists, so hopefully you'll be able to see Hazel on screen there. We also have Christine Batley, who is another one of our training specialists. And Hazel and Chris, you may have seen around doing training sessions for your practice. Thank you both. And we've also got Stuart Webb on the line too. If Stuart, you can pop your camera on so everyone can see you. But Stuart is one of our senior developers, and he has very much been involved in updating the recall system. So it's really good to have him on board and answer any questions that you may have. Now, the session's been scheduled for an hour. Let's see how we get on. I'm not going to keep you here all day, but equally I don't want to rush it as well. So I'll try and keep to an hour as much as possible. The session will be recorded, so if you do want to listen back to that recording, we will email it out to everyone that's registered on the webinar today. We will also make sure it goes onto our public website too. And I might actually get the guys to pop the recording page link to our webinars so that you know where to get that straight away. But we will be emailing it out to you, and it might also be useful if anyone's struggling to keep up, you've got that webinar to refer back to. I'm going to pop up some poll questions now and again, just to understand who we have in the room, how you might be currently using the recall system. And I think I'm going to start with a poll question right now, because it'd be really useful to know what job roles we have in the room today. So I'm just going to pop a question on now. It's just letting us know what your job role is. Maybe you work as part of the management team, the admin team, maybe you're a GP or a nurse, or maybe I haven't listed your role there, which is fine. You can just pop other in there, maybe pop your role in the Q&A. It'd be just good to get an understanding of who we have in the room. I'll just wait for that to come through. Okay, perfect. So lots of management team there, decision makers, brilliant, admin team. We've got a couple of GPs there too, nurses. So a nice little mix there. Thank you for answering that question. Okay, so in terms of what we will be covering today, and if I just find my mouse that wants to just disappear at the time I want to change the thing over, bear with me. There we go. So in terms of what we're going to be covering today, so I'm going to just give you a quick reminder of what is changing and why we're changing it, useful for those that wasn't able to attend our introduction webinar. I'm then going to walk you through the process live. So I'm going to open up my EMIS system, walk it through. This is exactly how you're going to be using it on your system too. For anyone that's currently using or has been using our LTC Recall system before we updated it, I'm then going to tell you how you can migrate across so that you're comfortable in knowing how to do that. We're then going to discuss next steps, and more importantly, we're going to discuss training. Please do not feel that this is your only training session that you're going to receive. That's not the case at all. We will be providing lots of training throughout the year to make sure that all of your staff are covered. Now, in the introduction webinar, I let you know that we've updated our recall system really to prepare you for upcoming changes such as NHS Notify, and also, so hopefully you've heard of NHS Notify, and also automated recalls, which we will be offering to you soon. And what we've done is we're also making sure that we're always enhancing our recall system to better support you with this area and to make sure that you're streamlining your process as much as possible. So what we've done is we've given EMIS practices a new approach to LTC. We're looking at the whole LTC pathway approach this time. So everything from helping you to invite patients, to review patients, to assess patients, and to evaluate. So it's supporting all of your staff who are involved in this process. What we're also doing, and it's quite new for EMIS practices, is if you were using our previous system, we very much focused on QOF, didn't we? So patients were on the QOF register, and we were making sure that their annual reviews were done for that purpose. What we're doing in this new updated recall system is we're expanding beyond that. We're also giving you the option to be able to look at IIF and also incorporate best practice conditions as well, which I'll talk about during this webinar today. We have further enhanced our templates for you, so we've continued to support you with data capturing, making sure it's accurate, helping you with your decision support, and we've also incorporated risk stratification as well, another hot topic, and we want to make sure at every opportunity we're supporting you in that area too. So we let you know that in the webinar that this will be available to you in early April, and we've definitely delivered that, and it's available for you right now to start using. Don't worry, I'm going to be talking you through how everything works, but just so that you know what is available, you will have a brand new LTC review report folder, which I'll show you today. You will also have an LTC annual review launcher, which you will pop on your F12 key, and it's an easy way for you to be able to access our templates that is associated with this and any other documents and templates and resources that are associated with this area. And we've also provided you with 2 updated templates, which is the LTC initial assessment template, which is useful for your healthcare assistants, and LTC review templates to help with your GPs and nurse with reviewing notes and deciding on the next action. Now, if you were using our previous system now, because we've obviously got this new system in place, and if you were using our multi-morbidity templates, which I'm sure a lot of you were, please do not worry. We're not taking them away from you straight away. We're going to leave all of that in place for you until April 2027 next year to give you the whole year to learn the system, to make sure all of your staff are trained, and for you to switch over when you feel ready and comfortable to do that. So we're not taking anything that was previous away from you, that will still remain in place. So just a quick reminder of the process, and then I'm going to walk you through. So what you'll see today when I'm demonstrating the resources, we're going to look at this in 5 stages. So the whole pathway approach includes 5 stages, and we're helping you with every step of the way, every part of that LTC management. So looking at plan, helping you to be able to look ahead, look to see how recalls will look like for you in your practice and how you'll be inviting those patients. Then helping you with the notify stage for you to invite patients in for their initial assessment. The assessment stage for your healthcare assistants then to capture all of those initial findings before the GP then reviews the notes and decides on what needs to happen next for that patient. And then we're going to help you with the evaluate stage so you can monitor activity throughout the year, learn from it, improve on it, understand what you've done, what still needs to be done, so that you've got that full picture of what's going on in your practice. So I'll talk about the evaluate stage too. And very much reminding you that this is pretty much involving most of your practice team. So it's really important, although we've got lots of management team on here today and lots of the admin team here today, what about your GPs? What about your nurses? What about your healthcare assistants? They had all of the relevant training in place in order to support you in this area? And I will mention training and support near the end of the session too. So hopefully that gives you kind of a good understanding of the different areas that we're going to be covering and the concept of what we're trying to achieve. I'm now going to go into my EMIS system and I'm going to start walking you through the process. So I'm going to first of all walk you through the process, and then we're going to look at the migration steps that you need to take to switch across to this new approach. Now, while I'm doing that, I'm just going to fire off another question, because it'd be really good to understand how many of you are currently using the previous Ardens LTC Recall System, so I know how many of you will be sticking around near the end to make sure that you are getting those migration steps. Perfect. So we've got about 79 of you, 74%. Most of you are using it. That's brilliant. Okay. So starting from the beginning and looking initially at the plan stage. So with the plan stage, this is all around using the reports that we have now made available for you. So I'm going to go into the population reporting area, which is where you would find all of your Ardens searches. And I'm looking out for the Ardens searches folder. Now, at the very top is where you'll see our brand new 1.00 LTC reviews folder. And that will contain all of the new reports that you need for this new recall system. Now, probably if you are looking at your system right now, I can hear you all saying, but Charmaine, I can't see that in my system. That's because we only released this on Thursday. So unless you were really keen over the Easter weekend and you spotted it was available and you downloaded it, most of you may not have this folder already. Now, in order to get it in your system, if you haven't got it already, you can either wait and do nothing, and we will update you on your next routine schedule, so you can wait for us to do it, or you can download it from the portal right now. So what I'm going to do is I'm going to get my colleagues to post in the Q&A the instructions on how to use the portal. If you do want to start using it straight away, you've got the option to be able to do that. So once it's in your system, it will always remain at the top of the Ardens searches folder. And when you open it for the first time, you'll see that there's two folders available for you. And this is where you need to make one of your first decisions on how you want it working for your practice. So, do you just want to focus on recalling QOF and IIF? So for your annual reviews, you just want to focus on that only? Or do you want to incorporate your best practice conditions? Both folders work the exact same way. The only difference is the best practice folder will include a few more conditions because it's pulling in the best practice conditions. Now, we did show this slide in the webinar, but just in case you want a reminder of what conditions we do include for best practice, I'm just going to hold this here for a little bit. In the meantime, I'm going to get my colleagues to post a support article in the Q&A, which lists out all of these conditions that are included as part of best practice. So you've got things like celiac disease there, you've got PCOS, you've got epilepsy, severe frailty, etc. So if this is something that you want to also start including, then that might be useful for you to be aware of, and I'll get the guys to pop it in the Q&A as well. Okay, so once you've decided on what folder you want to use, this is only my recommendation, but that's because I don't like getting confused too much. So if there is a folder that I'm not using, I would recommend just doing a right click and removing it, just delete it. So you're only focusing on the folder that you want your practice to be using and all of your staff members to be using. For the purpose of this session, I'm going to be using the best practice folder, but remember, it doesn't matter what folder I'm using, it follows the same structure. When I open up the folder, you can then see we've broken it down by annual reviews and interim reviews. The main bulk of your work in this area will be done in the annual review folder. So this is where you're inviting your patients in for their yearly review. But you've also got the interim review folder, and that's mainly for patients that have diabetes or heart failure or CKD. And as you know, there are particular requirements that may see the patient come in a little bit more than just once a year. So therefore, we're separating out those groups of patients who need those interim reviews so that you can then invite those patients in accordingly. But I'm going to start with the annual review first, and then I'm going to move down to interim review. I'm hoping this is making sense, all sense so far. So When you open up the annual review folder, you can see now it's broken down by the 5 stages that I mentioned. So this is really good because then as your role, you can then go into the folder that's most relevant for you. Remember, this is a whole team thing, and it depends on your role. You may be dipping in and out of these different folders. And I'm going to start with the plan folder first of all. So what this folder is doing, it's helping me to understand my population of long-term condition patients. It's helped me understand what the recalls will look like for the year ahead. So it then gets me thinking about, do I have the right workforce to deliver this? Do I have the right clinics set up to deliver this? This is what we're doing at the planning stage, and mainly this is going to be done by your management team at the beginning of the year. I see this being used the most. You may dip in it every so often throughout the year, but it's mainly going to be used more at the beginning and the very end to help you with your planning. So the conditions folder, we just right click and we select run. And what that will then do is it will highlight how many patients are on each of the different condition registers for my practice. So we're giving you a whole total number. So this is just my whole total number of potential reviews I'll be doing for the year ahead or whenever I decide to run it. And we're also narrowing it down by each condition. What we're also doing for you is breaking it down by condition group, which is really useful because if I am seeing patients by certain clinics, for instance, I can look down that list and I can see at a glance that my respiratory clinic is looking like it's going to be quite busy for the year ahead compared to my mental health clinics. So therefore, I can then make a decision on whether or not I've got the right workforce in place to be able to deliver this work ahead. So that's the conditions folder. I'm then going to move down to the recall month all folder. So what that's now doing is out of all of those patients, it's telling you how many patients will be recalled in each month. So really useful folder. This is giving me top level information, helping me then understand what it would look like again for the year ahead and how I want to be inviting those patients in throughout the year. Looking to see what months are busier, what months are quieter. So for instance, I've got more patients who will be recalled in April than I do in February. Now, bear in mind, I'm using a test environment, so the details that you see on screen won't be real. I bet you wish your numbers were as low as mine. But I can see at a quick glance here that I've got 10 patients that will be recalled in April, but I've only got 1 patient that will be coming in December. So I can look at this data and then decide how I want to run with it for the year. Not all of us live in the perfect world where we may be recalling patients over a 12-month period. Some of us may want to recall patients in just the 10 months and leave the last 2 months for catch-up purposes. I was at an ICB event a few years back and I listened in, and they wanted their practices to do everything in 6 months, particularly when it came to patients who were born in winter and getting them prevented before the winter months, seeing them a bit earlier in the year. So this here would just give you a good understanding of what it will look like for you so that you can then work out a schedule of how it's going to work. And I always say this in all my training sessions, literally put down a schedule. In April, I want to invite in my July and August. In October, I want to invite in X, Y, and Z. Share it with your team, and then everyone is then on the same page on how you want to be inviting for the year ahead. Now, this folder here, because a lot of what we do is based on birth month. So a lot of the patients coming in each year are being called in their birthday month. However, there may be certain patients who can't come in their birthday month and they've chosen to come in a different month instead. Or you as a practice have decided that there are particular patients who need to come in different months instead. And this is where the recall month chosen only folder will work. So this is looking at patients who are not coming in their birthday, they're coming in a different month. And I'm going to give you some examples of this so it makes sense. It might mean that you are a practice that has a real high population with uni patients. You've got a load of patients who are born in the summertime, but you know they're not going to come in because they're going home during the summer months. So therefore, you want to make sure they're coming in term time only. That's one of the examples you may use this. You could have a partners, so husband and wife, or just partners in general, who wants to be recalled in at the same month rather than going in on their birthdays. That could be another reason. Or you might have a patient who lives abroad parts of the year. I'm working on it, don't worry, parts of the year who want to be invited in different months too. So therefore, this is where you can use the chosen only. Now, if you were using our previous recall system, you would have been using a mechanism called recall arrange. So what you would have done is you would have popped a code in to say that this patient needs to come in this month. For this new system, you will not be using a code anymore. You'll be using a diary entry instead. So if you want to say the patient is coming in a different month to their birthday, you have to put a diary entry in. Now, please don't worry if you think, oh my gosh, I've got a load of patients who've got this recall arrange code in their record. It's fine. We will help you identify those patients, and when you migrate across, we will help you in migrating those patients over to a diary entry instead. But going forward, anyone who needs to come in separately to a separate month will need that diary entry in their record. And I'm just going to show you what that is. So I'm going to go into a patient record just quickly. And I'm just going to do it from the patient record, but bear in mind you can go into our templates to do this as well, and I will show you what that looks like in a minute. So I'm in the patient's diary screen. Yeah, come on. There we go. And I'm going to click on Add, and I'm going to click on Diary Entry. And the diary entry that you need is Chronic Disease Recall. Make sure it's this one here. It won't recognize any of these, so you have to make sure you put in chronic disease recall. And don't worry, all of this information is available on our support article. Double click the entry, and then from here, then you can then decide the month that the patient's going to come in instead. So if I click the calendar, this patient's born in May. Instead, I want them to come in June, for instance. So I pick any date within June and then pick a suitable year to put in. We recommend put something in the future. I'm just going to put in a year ahead. Now, the reason why I'm doing that is when I click on OK, in a year's time, that diary entry will flag up red. So that just gives me a prompt then to maybe check to see whether this is still relevant for the patient and whether or not I still want to keep that code in. Now, if for any reason the patient decides that they no longer want to come in that particular month, they want to revert back to their birthday, then you do have to make sure you're in the diary tab for that patient, right click on the patient and delete the entry. It's okay to delete it. You can complete it if you want, but equally it's okay to delete it as well because it's just a mechanism that we're using to say that the patient needs to be called in a different month to their birthday. So hopefully that makes sense, but that's how you would do that particular process. So that's my chosen only, and that will allow you to keep an eye on how many patients you have put that diary entry in for, so that if you do every year want to do a bit of housekeeping, then you can have a look at that list and decide if that patient is still to remain that way. So hopefully, out of these 3 folders here, that now gives you a good understanding of how you're going to be delivering your recalls for the year ahead. Moving down to review before, this is more of your housekeeping reports, and we recommend that you do this before you start doing a load of bulk inviting, because these are patients that you probably want to consider whether or not you want to include them as part of your inviting, so as part of your recall system. So when you run this, so again, it's just the right click and run, it will display results, but probably not as many results when you first start switching over. And the reason why is because there is particular codes that you have to use in order to make this recall system work. So there's particular invite codes you use, there's particular codes that you have to use to say an initial assessment has been completed. So a lot of this is looking for those codes. When you do run them, you might find that there's a lot of zeros to begin with, but over time you'll find that those results will start to build up as you start using the system more. Now, I'm just going to pick out the ones that are probably going to be relevant and more populated for you now, but you can see there that we've put all of the description in a title for you, so that should make complete sense on what you need to be doing with them. We've also got a support article that we can share for you. So the first one I want to pick up is this one here. Consider coding default from follow-up. I'm not going to spend too much time on this, but this is looking at patients who have a reasonable adjustment. are on a learning disability register, they have dementia, or they're under 16. And it's answering you whether or not you want to include these patients as part of your invite process. So it might mean that there's a different pathway that these particular patients follow. Maybe you don't do those particular services for the patients in your practice. So therefore, there's no point of inviting those patients in if you're not going to offer the service for that patient or it's been done elsewhere. So therefore, what you can do is you can put in a code which we call default from follow-up. So the code is in the description for you. And what that would do is it will remove the patient from the recall system for that financial year. Just for that financial year. The patients will appear back again the year after. And you may want to use that code for other scenarios, not too many, but you may want to use it, for instance, there might be particular conditions that you just don't invite in for. In your practice, you may want to apply the code for that. So you can go back to your condition folder, the conditions you don't invite in for, you can apply that code in, and that will then remove the patient from the recall system for that financial year. So this is just your LD, your end of life, your reasonable adjustments, your dementia. Now, if you decide, no, I do want to invite those patients in, don't do anything. And I'll show you where you can pick those patients up in your notify report shortly. But anytime you manually put that code in, and that has to go into each record, it's not removing the patient from the QOF indicators at all. It's just removing them from recalling them in for that financial year. Anyone you do put that code in for, it will go into the exceptions folder. So here you can keep an eye on the number of patients that have that code in their record. Moving down then, this one here. So this is looking at all of your patients who have reasonable adjustments. Now, you would normally just code the fact that they have reasonable adjustments. But in order for you to be able to manage those patients separately when inviting, because you may want to consider the method that you invite them in for, you will need to make sure you put a dual code in. So we're servicing all these patients for you. They would just need to ensure that you also have the patient recall admin code in, as well as that reasonable adjustment code. And our support article will tell you how to do that. And the rest of it should be quite self-explanatory, so I'm not going to explain any more there, but that is our plan folder. Hopefully that makes sense and that gives you a good idea of what your recalls will be looking like for your practice. Give us a thumbs up if that is all good. I don't know whether it's worth really quickly checking in, Hazel, Stuart, Chris, anything that you want to just add to that. Thank you for the thumbs up so far. Anything you want to add to that before we move to the notify stage?
I think that's all good, Charmaine. We've been answering some questions as we go along. So, yeah.
Good, thank you. Okay, cool. Moving on to the notify stage then. So this is looking at the inviting. And what you're doing here, and I cannot stress enough at this stage, because this is mainly kind of a new approach, although some of you may have been doing it a lot, is we're inviting patients in for an initial assessment. The way that this system works is we're inviting patients in for an initial assessment first. They see the healthcare assistant and then they see the GP or nurse. I'm actually going to pop up a question right now to see how many of you are currently inviting your patients in for an initial review, because that will give us a good understanding of how you're currently working on it. Let's pop that in there. Perfect. Good to see more yeses and nos. Yeah, a lot more yeses. Brilliant. 60% of you, 62% are actually inviting in for initial assessment. So that's good to know. Okay, so when I'm inviting my patients in for the initial assessment. Now you can see here we've broken it down by different cohorts, and this is just making it easy for you to prioritize how you want to invite your patients in. I'm going to do it in a particular order because I like working in a really logical way, but you can do it however suits you, however your process is within your practice. So for me, I'm going to start with my asthma only patients, because these are patients who just have asthma as a condition. They don't have any other conditions at all. So it might be really easy for me to quickly fire off a text message or an email, or however you currently do it in your practice, getting them to complete a questionnaire. Maybe that's how you do it. Maybe they see a particular staff member before they see a GP. So these patients just have asthma only. Now, I'm in the best practice folder, and there is something that I do want to explain. So because I'm in the best practice folder, it's given me all of my patients who have been coded with asthma, where it's not been resolved. So they've got asthma as their latest code, and that's it. So that's the patients I'm going to invite in. If I was using my QOF and IIF folder, that follows the QOF business rules. So that's all my patients who have asthma and have also had an inhaler issued or medication issued in the last 12 months. So if you are, hopefully you just pick a folder and that's it. But if you do see a difference between the two, that's why. For best practice, we're just inviting all of our asthmatic patients in. So once I've run the folder, and the way that you do that is you right click and you do a run and click yes here. And that will open up the run parameters screen. And this is where, you're using our previous system anyway, so you're quite used to this screen already. But this is where you're indicating what month of birth you want to invite in. I don't have to be in April to invite in April. I can do 3 months ahead, but I have to do it one by one. Invite my April in first, then invite my May's in, then invite my June's in. So from here, I'm selecting the month of birth that not month of birth because it's also chosen months, and my recall month that I want to invite in. So I'd select the month and I would then click on OK. And what that would then do is it would find me all my patients who have yet to have their initial assessment yet. It breaks it down by first invite, second invite, and third invite for me. So these patients here have never had an invite for this financial year, and that's the list that I want to start on first. So I can click on the view results option, and what that would then do is it will provide me with all of the patient details. It will let me know if they have any reasonable adjustments, although we do have a separate way of inviting those patients in. And it's just asthma for these patients. So I'm only seeing the asthma column, and it's telling me the asthma code diagnosis date in there that they were diagnosed. It will also give me the home number, the mobile number, and the email address. So you'll notice that we're not breaking it down by text, mobile, and email because it's all in the report for you. From here, I can then export it as a CSV, tick first option, third option, fourth option, and click on OK. Again, this is available in our instructions, and that will then export the report for me. And then from here, I can do any further filtering if I want to, but more importantly, I can then start batch inviting these patients using my third-party messaging system, whatever that may be, to start inviting those patients in for their initial assessment. So I do that obviously outside of the system, and once that's all done, this is a really important step. So in order for the patient to move through so the Ardens long-term condition recall system, there has to be a particular invite code that you have to add to that patient's record. It's a generic one that you would be using for all of your patients. We have to let you know exactly what that code is here. So at this stage here, you will now be batch adding that code to all of those patients that you have just invited. So I'm going to go to batch ads at the top there, and I'm going to batch add a clinical code. Again, you're probably really used to this process. Batch ads, I'm going to click on the search option here, and I'm going to search for that code that I need to pop in. So it must be this code here. So I'm going to pop that in now. And it's this code that you're using. Double click on that code and then click on OK. Add a description in there, so whichever description you decide on as a practice. And then I need to say exactly what population of patients I want to add that batch add to. So I'm going to navigate back to that first invite search. I'm going to go to Ardens searches, back into my LTC folder, back into my best practice, back into my annual review, notify, asthma only, and for first invite. I'm then going to click on OK. So when I click on OK, what it will do is it will apply all of those codes to that group of patients. This is really important because then the patient will then move through the long-term condition recall system. Now, if at this point you want to add the QOF code as well, then that's absolutely fine. I mean, most of you or some of you may already be doing that through your text messaging anyway, where you're applying the code to the text message or the email, and that's automatically writing it back into the patient's record. So some of you may be doing that process automatically, but if you are needing to pop that information into your clinical system as well, just do another batch add of the QOF code. You may want to use the generic QOF invitation code to save you having to put loads of different codes in, but that option is there if you do want to make sure you're ticking off your QOF as well as making sure you're moving this patient across the Ardens recall system too. So hopefully that makes sense. So that's all my first invites done. Now, patients who have received a first invite, but there's no indication that they've had an assessment or a review, will then drop down after 2 weeks into the second invite, so I can send them a reminder. Doesn't mean you have to do it dead on 2 weeks, but it's telling you, look, it's been more than 2 weeks, these patients are still not responded yet. If after 2 weeks' time they still not responded to their second invite, they will then drop down to the third invite folder for you then to, or report, sorry, for you then to be sending them a third invite. And it's the same code that you're applying to all of them. And the reports are clever enough to understand what needs a second and what needs a third. Don't worry that the codes are not different for each of those. Same process, export the report out, invite those patients accordingly, make sure that they have that code in there. Now, for QoF purposes, we know that 2 invite codes is enough for your exception. But if you want to look at best practice, that's why we're giving you the option to invite the patient in for the third time. There's been plenty of times I've done training in the past and people have said, well, what happens after 2 invites? We want to be able to send out a third one. That's why we're giving you the choice to be able to invite patients for a third reminder. If they still not responded to their third reminders, I'm going to show you a folder in a minute that will pick up those patients that you can continuously start inviting those patients in if you need to. So that's your asthma only now. So those patients have all got their questionnaire ready for their initial assessment to be done. From this stage, I may then want to move down to my patients where there is no considerations that I need to think about. So they haven't got any reasonable adjustments, they're not on any learning disabilities or registers or anything like that. This is a standard invite that I can send out to all of my patients. So again, it's the exact same process. You've got your report here, and I'm not going to go through all of it, but there's something I want to pick out on here. So you can click on view results. What we've got in this report here is not only your contact methods, but if you move to the right hand side, we also tell you what condition registers they're on too. So if you do want to filter any further when you're inviting to prioritize your patients, you can do that once you've exported the report out. And Hazel, Chris, can you just pop in the support article on how practices can export to support them with that as well? That would be really good. So invite my patients in, pop the code in, and then I'll move down to second and third, depending on what the time frame is. From my exclude and considered method, I now want to go into my consider method, because this is where it might be a little bit more complex. I might need to decide on how I want to invite these patients in. So consider method includes any patients who are under the age of 16, any patients who have dementia, on the end of life register, on the learning disability register, and have a reasonable adjustment. But they will only appear in this report here if they also have the patient recall admin. Remember, I explained that in the plan, that it has to be dual coded. So therefore, I would go ahead, do the same process to invite my patients in, and that's my consider method done. Your care home patients and your housebound patients will be completely removed out of these invite reports at the top, to give you a list to work on, because you'll be dealing with these patients separately. So here are all of your care home residents, and here are all of your housebound patients. So again, you would go away and you would action those patients accordingly. The last folder in here is to chase. Remember, I said to you, if they've had more than 3 invites, they still not responded, then this search here is really useful to pick those patients up. We're also letting you know where it's been more than 3 months and there's still not been a second invite and there's still not been a third invite. So you've got your safety netting in there to pick these patients up and get, the opportunity to do that as much as possible. So that's your notify stage, inviting patients in by their month of birth or by their chosen month. You've got your different folders there, and remember, you're inviting them in for an initial assessment. So give us the thumbs up if you're all good with that. Checking in again with the people on the chat just to see whether there are any questions, anything that needs highlighting. Thanks for your thumbs up. Hazel, Chris?
Charmaine, just a little bit of confusion about whether you need to add the QoF code as well as the invitation code that's used through our system. Obviously you do, as you've explained, but a lot of practice will add that through their text messenger, won't they? So
yeah, absolutely. And then the choices there, if how you would normally add it, you would add it still. But the important thing is to note, in order to use this system and to move the patient through, you have to be putting in that generic code that I mentioned. Thank you, Chris. Okay, so moving on to the assess stage then, and this is where I come away from the reports now, because the patient has now been notified that they need to come in and have their initial assessment done. I'm now going to go into the patient record. And probably one of the first things that would happen is your receptionist will get a phone call to say, from the patient to say, can I book in my initial assessment? This is new and will be very helpful for your receptionist and all of your practice staff. So just make sure that everyone has this on their F12 key. So press F12 on your keyboards, and the new launcher that we've got in place for this process is called the Ardens Launcher LTC Annual Review. Hazel, Chris, can you just pop that in the, or Stuart, just pop that in the Q&A to remind people of what that is? So each individual user will need to add this to their F12, and this will give them access to the templates and also just any other useful information too. So the Ardens launcher then, so that the patient's now calling up and they want to book in their appointment. The receptionist wants to understand what conditions that patient has, so they know exactly what appointment they need to be booking. So I can double click on the Ardens launcher, and that will then open up this new F12 key. So it's telling me the last invite date. It will also tell me whether or not the patient actually has had their initial assessment, but they've forgotten or for any other reason, and whether or not there's been an annual review code in their record as well. So it's telling me the last time that that patient had any interaction with LTC. It's also letting me know what conditions that patient has. So I can see here that they've got hypertension, they've got COPD as well. And it's also telling me their month of recall. So this is patients being called in their birth month. If they weren't, it will say chosen only. So as a receptionist, I can see here, okay, they have hypertension, they have COPD. I know that I need to book the patient into X, Y, and Z clinic. They then got the option to hit book appointment, and what that will then do is it will open up the book appointment screen ready for them to book in the appointment for that patient. Okay. So that's your receptionist, so make sure that the receptionists are aware of that F12. Now the patient has had their appointment, it's now time to come in and see that healthcare assistant for their initial assessment. The healthcare assistant would press F12 on their keyboard, they would launch the launcher, and what they will be doing is launching our new initial assessment template. I just wait for that to load. Are there any questions? Hey, oh, actually, no, we're fine, we're good. We've got the template loaded now. So this will then open up the initial assessment template for me. And over on the left-hand side, it's broken down by the condition groups that the patient falls into. So normally with the multi-morbidity templates, we had the individual conditions. This time round, we're breaking it down into the different condition groups. So I can see that the patient is part of the CVRM group, respiratory group, mental health group, etc. The home page is very important start. So what the healthcare assistant would do, as soon as they launch this template, they would tick the box to say that they are starting and doing an LTC initial assessment. This code is so important, again, to move the patient through the process, because then it will then recognize the patient's had their initial assessment and it will remove the patient from the invite report. So very important that they tick that box. Down the bottom, again, it just gives me further details about the previous entries, whether or not they're being recalled in their birth month or not. And if the patient does say, look, going forward, I don't want to be invited in around my birthday, I want to be invited in another month, you can see here that we've also got the box here for them to be able to add that diary entry. So if you rather do it that way, then the option is in there for you too. Also tells you what conditions they have as well. The lifestyle page is quite straightforward for the healthcare assistants. This is just capturing things like the body weight, the height, the alcohol status, smoking, etc. It saves them having to complete that on every single page. I can do it all on this one page here. And then they would then go into the individual condition groups and they would then capture the information for that initial assessment. So my patient's got hypertension. This is all of the initial examinations I need to be capturing for that patient. So really straightforward. You can notice there it highlights anything important that they need to be considering as well. And what we also have is the screening section. So if at the same time the patient has reported any other symptoms that may indicate that there may be another condition, perhaps they can also be recording the information under the screening. And it might mean that you have a policy where you say, look, I always want my healthcare assistants to be checking for this particular screening. That information is in there for them to capture. So really they're looking for the actual conditions, and this is all smart working, so they'll only see these sections if the patient has the condition, and they will go ahead, complete the information. They've also got the test bloods page, which is really handy because you know we've got the blood test due analyzer here. This is just incorporating it in the template, so they can look to see what blood test is due for that patient right now, what's coming ahead, and they can even record the fact that they've done the procedure here, all on one template. They don't have to go anywhere else to do that. So the healthcare assistant will capture that information, make sure, and again stress again, that they tick the box here, and they would save that information, and that will then save that back to the patient's record, and that's their initial assessment done. Now, at this stage, if your process is that your healthcare assistant will now book another appointment for the patient to come back in and see the GP or nurse, then they can go ahead, they can do that process. That's not a problem. When the GP and nurse then sees that patient, they would then open up the review template. However, if you want to use the system the way that it is designed, and perhaps now, rather than the healthcare assistant book the patient to come in for another visit, you want your GPs or nurses to review the notes first and then decide on the next best action for that patient, then this is where you would use our review reports. So I'm just going to go back into population reporting, and under the review folder, I'm going to click on my to-do list, so my to-do folder. And within my to-do folder, this has given me a list of all of my patients who have had their initial assessment. It's been more than 3 days. That gives me enough time for blood results and things to come through, who now need to have their notes checked to decide on what next action is best for them. Because it might mean that you look at these notes and it's just a message that needs to be sent, and then you can mark your review as complete. Or perhaps just a telephone call, saving the patient to come back in again. Perhaps there's no review needed. So this gives your clinicians the option to be able to review these lists of patients and then decide on what they need to do going from there. So what we have done is we've given you just a list of everyone. If you just want one big list that you want your GPs to be working on, fine. If not, then we have broken it down by different conditions. Perhaps you've got clinicians who are working on particular clinics. We've also provided you with patients who just have one long-term condition, nothing else, or patients who are just in one particular long-term condition group. So if you've got a respiratory nurse, they may only want to be looking at the respiratory notes. So you've got the option to be able to do that. What that will then do is we'll provide you a list of those patients. You would hit the report that you want to use, and then you would click on view results. Unfortunately, it's a shame that I haven't got anyone on there, which is a shame. But that would just give you the option to be able to view those results, and then you would then go into each of those patients individually and review their notes. So let's say I did have a patient there. I hit view results. It shows me my list of patients. I can keep that report open if I want to, and I can now go back into the patient record and I can find that particular patient. So I'm now the GP now who is now reviewing those notes. Press F12 on my keyboard, launch the launcher. I can check through the notes if I want to, but if I want to look at all of the different information that healthcare assistant has captured, I can go back into my launcher, and this time I want to be using review. But note that we also help you understand what tests are due, what contract requirements are due, and whether or not I want to also incorporate a care plan. So I'm going to hit review. And this will now open the review template, quite similar to the initial assessment template and how that works. Let's give it a time to launch. Very quite similar to how you were using the previous multi-morbidity templates, but it's just further enhanced. It's just got a few more information in there for you. So I've got my home page there. I can see when the last initial assessment was done as well. And then from here again, it's broken down by my different condition groups. And all I'm really doing here is filling in the gaps from what that healthcare assistant couldn't complete. So I would see all of the initial examination findings that they've captured, and I can then go ahead and complete my information and also my impression. This is what we mean by risk stratification. You've got your traffic light system there. I can indicate whether it was well controlled for the patient or not, with further information that I can capture there. I've got my management here now, so this is now me deciding on the next step for the patient. Is there a medication review that needs to be done, a care plan? What's the actual plan for that condition for that patient? I can use the free text box to be able to complete that. And that works the same for each of these pages on the left-hand side. It's important to note that you need to make sure that all conditions are completed for that patient. And if you are happy that all conditions are completed for that patient, you go back to the home page and you tick the box to say that that annual review has been completed. Now, if I've decided I actually want the patient to come back in for another appointment, I'm not quite ready to close off their review yet because there's still care that I need to provide for this patient. Or perhaps I'm a clinician who only does the asthma part and I've got another colleague who's doing the mental health part, for instance. So therefore, we've not completed that review just yet. Rather than click on LTC annual review completed, in that scenario, I can tick the box up here and instead say that, I don't know, a follow-up was arranged in 2 weeks' time or further conditions need to be reviewed. And what that will then do is when you save that template, it then holds those patients in reports. So I'll show you where those reports are. If I go back to population reporting, back to review. So patients who I've started but not completed for one reason or the other will then appear in the done but not completed folder. And then I know that I still need to pick these patients up and I still need to make sure that they're completed. So very good if you're waiting for the patient to come back in, or perhaps you're not reviewing all conditions, you're only reviewing some. Your colleague can therefore pick them up. But once you have completed that review, it's so important to make sure that you go back using that template, that you actually make sure that you've completed that review. And I just want to remind you of where that is, because it will then move the patient through. Well, actually, it will stop the patient at that point then. It's saying, look, the review has been done for this financial year. So I'll just wait for that to pop up. Hazel, Chris, I'm sure there was questions around that process there. Any insights or questions you want to discuss at that point? Oh, Stuart.
Charmaine, not around that, but we've got quite a few questions. People saying they can't see the LTC launcher. Yep. I'm suggesting that they go into Resource Publisher and click refresh.
Yes,
and then
definitely.
You should be able to see them.
Definitely, and I'll show you how to do that at the end, so you can know how to find that refresh option. Okay. So that's the review process, and that's pretty much the main bulk of work you need to do for the recall system. So hopefully that's made sense. Give us a thumbs up if you're still with us and it's all making sense so far. But this then, thank you very much. This then is your plan. You've done your planning, you've done your notifying, you've done your assessing, and you've also done your reviewing if you want to go down that route. And then the evaluate stage is really straightforward. It's just checking your activity for last month. So how many annual reviews you've completed last month, and also how many reviews have still not been done yet. So that kind of gives you your progress throughout the year. So that's my main annual reviews. Hopefully that makes sense. So for your interim reviews then, like I mentioned, this is patients who have CKD, diabetes or heart failure, where you need to do a 3-monthly, 4-monthly, 6-monthly review based on previous results or previous reviews. So therefore, and you'll be quite used to this, you know this anyway, but this is where you will find your reports going forward, and you can invite those patients in accordingly. Same process as the annual review one, really straightforward, but that will give you a list of patients, also broken down by care home and your housebound patients too. Any questions? And then I'll move on to the last part, which is the migration step. Hazel, Chris, any questions we want to talk about? Stuart, I think we've got Rob on the call as well. They might be lost in questions. Nothing?
No, I think
so. Thank you.
You done? Okay, cool. So that leads me to the last part, really, talking about switching over. And I am going to pull up my presentation slide to walk you through this particular slide, things that you really need to be thinking about. So that's the list of codes, by the way, but we will share these PowerPoint slides, but all of the codes that you need to be using in order to make this system work, these are all the codes here, but we will make sure that these slides are shared so that you've got these going forward as well. So we have let you know that the previous system that you're using will remain in place for the year. So you've still got that to go to use for the next year, where you get comfortable with how to use this new approach. Hopefully it's easy for you to use and for you to then decide on when you want to switch over. So it's really important that you now decide on the most appropriate switchover date for you, when that would be. Once you've decided on that date, you must ensure that all of your staff have had the relevant training before that switchover date, because your GPs and nurses need to know the template they need to be using. Your receptionists need to know the launcher they need to be using to understand what appointments they need to be using. So make sure that all of your staff have had their relevant training. Once you have decided on that switchover date, make sure that your clinicians are using that new template. So make sure they're using the initial assessment template, they're ticking the right boxes, and make sure that your GPs are using that review template and they're ticking the boxes that they should be to say that the review has now been done. You also want to be advising your admin staff to be using the notify reports too. That's important, so they can start inviting in the new way and using this new approach. And then you also need to assign a lead admin person to action the setup reports, which I'm just about to show you now. So as you can see there, like I mentioned, there's a lot of coding that we're using for this new approach. Some of these codes you may not be using at all. You may be using for different things, hopefully not, but you may not be using them at all. So therefore, we need to start switching patients over to have these codes in their record in order for the system to work well. So what we are advising that your admin team does, so a lead person or people in your practice will start using these setup searches to get you switched over. So you'll find them under annual review, and then under plan, you then got the option for setup. The setup folder will then, it's just a case of working down this list, and you can decide to do it whenever you want to start getting ready to go over. The very top report is looking at patients who potentially have had all of their reviews completed for this year. So what we're doing in this report here is we're looking at all of the annual review completion codes that we used in our previous system. And if we can see that the patient ticks every single one of those boxes, depending on what conditions they have, we're telling you that it's safe now to say that these patients have had their annual review completed. So what you would do is you would batch add the annual review completion code onto all of those patients to say that they've had their review for that financial year. If you rather do it via by individual patients, you can do that as well if you want, but you're safe to just also batch add them all to say, look, the review has been completed for this year. And it just means that you're not inviting those patients in again for a review that they've already had. So that's the very top one. The second one down, we provided you with an extra report. And the reason why is because this looks like patients have had some of their condition reviews, but not all of them. So what you don't want to do is put a completion code in to say they've had everything done when that's not actually true. So this report here, if I click on this report and I click on view results, this report here will allow me to see who the patients are and what reviews they have had done and what they haven't had done. So it's up to you then to go into each of these individual patients and then decide whether or not the patient needs to be invited back in for their review to make sure it's all finished, or whether you're quite happy for them to have that completion code in. Whatever you decide, someone needs to be working down that list and making sure you're switching these patients across. The third one down, and we will have instructions on all of this, but the third one down is now looking at patients where you used the recall arrange code in the previous system, who now need to have a diary entry in their records. And remember, recall arrange was switching patients from their birth month to a chosen month. For this new approach, we're using a diary entry. So it's helping you work out who those patients are. So again, I can hit view results, and I will need to go into each one of those patient records and make sure a diary entry goes into their record instead. And again, we will provide instructions on how you do this. The third one down is looking at where you have used the chronic disease monitoring not required code. That is a code that we do not use as part of this recall system. So it's not going to do anything. So if you do not want patients to be part of the recall system this year, remember they have to have the default from follow-up code in their record. And then that way you're removing them from the recall system for that financial year. So it's important, again, you view results, you work down your list, and you put in that default follow-up code in if you do not want the patient to be part of inviting for that financial year. And then the last report down the bottom is looking at where these LTC codes have been used in general. So these are all of the LTC codes that we use as part of our recall system, and it might mean that you've used these codes in other different scenarios. So what we're basically saying is, because these patients have got these particular codes in their records, they're going to be marked as completed straight away. Do you want that? If not, again, we need to be thinking about what we do with those codes in the patient record in order to make sure that they do appear in the relevant places in the system. So that's the setup process. So it's just a case of, just going back to this slide here, you decide on your switchover date. I'm going to be really honest with you. The sooner you can switch over, the easier these reports would be here. So you're probably more beneficial to look at doing it in the first quarter of this year rather than wait too long, particularly if you've got a practice who's got quite a high population. You may want to think of a date quite soon, but don't worry, because we are offering practice level training to support you with all of this anyway. And if you do decide to wait a bit longer, that's absolutely fine, but just note, whatever date you decide on your date. Let your practice staff know, make sure everyone's trained, make sure everyone's using the templates. They can even go away and start using them now. There's no harm in that. And then assign your lead admin person to be able to go through those setup reports and action those. Once you're all done, you're good to go. So it's easy as that. So that's the setup process. Hazel, Chris, any questions in general? Because surprisingly, we've finished bang on 2 o'clock.
Charmaine, just to put a spanner in the works, a lot of practices have been asking what they do if they don't do an initial assessment, or if they don't do an initial assessment for certain conditions.
I'm going to get either Stuart or Rob to answer that question if they're on the call, please.
Hi everybody, it's Rob here. Charmaine, thanks for that. It was absolutely fab running through. I think the only condition where you can't bring them back, is for asthma, really, where you can do that entirely remotely. Because even something just like with hypertension, you'll still need to do some blood tests, so they'll still need to come in for those blood tests, and those blood tests will still need to be reviewed. So if you're doing those blood tests beforehand, then fine, but then that can still be done as the initial assessment, because to sign off that annual review completed, those blood tests need to have been reviewed, and that's why they can be done at the initial assessment, and then the review can be a notes review on EMIS, looking at the reports in that manner, then it can be completed then. I hope that answers it and makes sense.
Thank you, Rob. Thank you. Any more questions, Chris, Hazel? Otherwise, I'm going to pull up the last slide.
Can I just say, someone's saying on there we're not answering all the questions. I'm really sorry, we're getting through them as quickly as we can. Some are slipping through the net, but we will answer all of these questions. If we don't get a chance to answer them now, then we'll go through everything when we finish, and we will get answers and get those all sent out to you. But sorry, we can't type quick enough.
Thanks, Hazel. I'm sure you guys are doing a great job. We will make sure we put together a frequently asked question for you as well, which we will share with everyone. So looking at next steps then, so really important that you agree on that switchover date. Make sure that all of your practice team that are going to be involved with this are aware of where you're going, and also have had their relevant training in place. In terms of training, I mentioned to you that we are helping you with every step of the way. We really are. This is not the only training session that you've got. So as of in the next hour or so, we're going to release some dates for you where you can book into getting started with LTC. Every 2 months we will have a session on, all the way up until the end of the year. So if you've got new staff joining and they need a little bit of a refresher in general, you can jump on and you can book that training. We also are doing targeted practice level training in which we can do in person if we've got a trainer close by, or we would do it remotely for you. We're going to target by ICB. So for each ICB, we're going to send out some emails to practices in that area inviting you for training, practice level training for your organisation, and making sure that all staff are involved in that. If you feel you need a bit of training a bit sooner, then you can contact us. Just contact training@ardens.org.uk and we're happy to take your request on and get some training booked in for you. It doesn't matter what that training's for, even if you just need support in that initial migration stage and then you want us to do more training after that, it's not a problem. Remember, training is free as part of Ardens. We can see you as many times as we need to. We also have support that's available. So we've got a brilliant support team. They are there on hand to answer any questions that you may have. If you do need to contact them, support@ardens.org.uk. We also have some really useful support articles that are available for you, which I'm sure my colleagues have been adding to the chat. And yeah, I think that's everything. So we're coming to the end now.
Before you go, can you just, we've got a few people asking about the launcher.
Refresh.
Still, they can't find them. So do you want to go into RP and show, refresh?
Yeah, thanks for reminding me, no problem. Okay, so if you want to hit a refresh configuration and you want resource publisher, but only if you're able to have access to that. So I'm going to click on resource publisher and just bear with me because I haven't opened it. So it might be, I'm a bit slow, 1 second. Hazel, have you got RP open?
Not at the moment, but I will, and let's see who gets there first.
Yeah. Apologies, it's because I haven't opened Resource Publisher yet, so it's it might be a bit slow. But it's the Resource Publisher module that you need. I have it open
if you.
Stuart, perfect.
What to do?
Yep. Do you mind sharing your screen for me? Brilliant. Mine just opened just as you did that. Okay, so in Resource Publisher then, you first of all need to, so at the very bottom you've got a folder that says, no, sorry, you don't need to do that. You just want to hit your refresh button. So I was just going to show you where the resources are, but I don't think it matters. So just hit refresh on RP. Only one person needs to do that, and that should then work for everyone else. If anyone else is also having trouble and you've already done a refresh, just get them to log out of EMIS and log back into EMIS again, and that should be good for you to go. But do contact us in support if you do have any issues. I just want to check, Stuart, we are publishing the launcher active, aren't we? So practices should be able to use it straight away. They don't need to activate the launcher in any way, do you know?
I'm going to pass.
It should be active.
Active,
I know it's active. Some people have got access to it already. So
amazing, cool. Okay.
Happy
so yeah,
for me to pass the screen back to you.
Yeah, no problem. Just bear with me. Okay. So hopefully that makes sense. So it's just your refresh button here is the one that you want to be using. So that just really brings us to the end of the session now. Really hope that you have all found that useful. Remember, it's not your only training session. If you do want some more training, then please do let us know. If you want to provide us with any feedback, then you've got the QR code there. You just scan that with your phone, provide us with any feedback. And thank you all very, very much for attending today. We're doing a webinar tomorrow at 12:30 on the COVID and RSV resources. So if you haven't had a chance to jump onto that webinar and sign up to that webinar, then please do make sure you sign up. It would be good to have you back again tomorrow. But that's it for now. Thank you, everyone. Just to come out of the meeting is the red leave button. And we will see you all real soon. We'll stick around to see if there's any more questions that need to be answered. Thank you all.